This Committee on Adjudications and Appropriations now comes to order. We have the notice to public hearing was disseminated to all local media outlets via electronic format on Tuesday, September the 12th, with a second notice provided on Saturday, September the 16th, 2017. Notice of the hearing was also made known on the Guam Legislature's website. We have three bills on this afternoon's agenda, all introduced by Senator Dennis Rodriguez, Jr. So I will allow him to introduce the bills and also speak on them this time.
Hafaday and good afternoon, Mr. Speaker, colleagues, and to everyone who's here today. I want to thank Speaker Cruz for the opportunity to have a public hearing on these measures. And if it's okay, and the Speaker is okay with it, then we can accept testimony on all three if you wish to do it at the same time. The impetus for these bills really is from work that the committee has done about 2 years ago, when we set up a task force. The initial goal of that task force was to look at the challenges of the Guam Memorial Hospital Authority and provide a long-term solution as to how we're going to keep that hospital viable. The discussions turned into not just the hospital, but looking at the whole general healthcare system, the infrastructure on island. And so we've came up with a report on that task force. We've established 10 points that we thought as a group that needed to be addressed in addressing the whole healthcare system. One of those points was to expanding access to insurance coverage to our people, because we know at the hospital, the biggest problem there is you have a big group of individuals that come there and don't pay for services. They don't have the ability to pay. They don't have insurance coverage. They end up at the hospital because they weren't able to see a primary care doctor. And so the service that was provided at the hospital is something that is costlier and is also more life-threatening at that point. And so part of the efforts to address that issue was three bills that we have in front of us today. We have Bill 131, the first bill, which is an act relative to establishing a statutory requirement to do two things. One is to establish a rate review on insurance premiums, and the other is to establish a medical loss ratio formula. The intent of both of these bills is, number one, to protect the consumers from unreasonable rate increases, and number two, bring down the cost of healthcare coverage through the provisions or rebates preventing excessive profiteering by insurance issuers. And as with the Affordable Care Act, these provisions are still in place in the mainland. For Guam as a territory, because we weren't covered under ACA, this provision was not necessary and not required for the territory of Guam. We did have it effective for, I believe, a short period of time until that ruling came down that it didn't apply to Guam. Guam does have, I understand, some of these provisions in some of the contracts that insurance companies do have with the government of Guam, number one, and I don't know, you may have it with the federal contract as well. And so what Bill 131 does is establish those two initiatives. For Bill 130, am I able to, Speaker, go through, or you want to do?
I was going to allow us to do all three, but people come up on different sides, some of them. And so let's do them seriatim, so that when the staff has to do the committee report, there'll be one for one and one for the other separately. So why don't we do 131 first? I'll invite Mr. Leon Guerrero, Mr. Carlos, Mr. Moylan, Mr. Mangiola, and Mr. Sablon to the table. Why don't we start with Mr. Leon Guerrero, then Mr. Carlos.
Thank you. My name is Ken Leon Guerrero, spokesperson for Guam Citizens for Public Accountability, and we are testifying in favor of this bill. One of my favorite quotes back in my consulting days was a quote from Edward W. Edwards Deming. In God we trust, everyone else must use data. The premise of all the work he did that brought Japan from a third world country to the number 2 economy in the world was based on the fact you can't improve what you can't measure. When I was an active member of the Non-Communicable Disease Consortium, the biggest problem we had as a consortium trying to put together programs to improve the quality of life and health here on the island was the lack of sufficient data. According to Department of Public Health, the effective diabetes rate here on Guam is 8.9%. According to a survey that was done by the Judah Foundation, we came in at 29.7%. So that illustrates the problem that we're facing. I applaud the Senator for taking on the Herculean task of trying to overhaul health care on this island. But for any effort to be successful, we're going to have a lot more data than we have right now. And so I think this is a good first step. I would like to see it expanded, to all collecting data from all practitioners, anomalizing it so that we can have the broadest possible data set to evaluate the chronic disease rate, the chronic disease rate growth, the different morbidity, the different outcomes, and the outcomes of different strategies that will be attempted by Department of Public Health, by Guam Memorial Hospital, and available to physicians as well, so they can look at the types of information they need to have to improve their practices, as well as these gentlemen here that have to pay for it. Thank you.
Thank you very much. Mr. Carlos.
Good afternoon, Mr. Speaker and Chairman Rodriguez and Senators. My name is John Carlos. I am a retired regulator, and I am a consumer advocate. I am in favor of Bill 131 for the following reasons. Subject to my submission of a written testimony on this bill. I support this bill. Currently, the Banking and Insurance Commissioner, which is Mr. Ilagan, does have the authority to review and approve insurance rates, and that authority and to review and to approve includes health insurance rates. The other aspect of this bill, medical loss ratio, because Guam did not establish an exchange or insurance market for the individual market. So there is, at some point in time, after Guam opted out of the Affordable Care Act, there is a question whether or not the medical loss ratio provisions of the ACA apply. So at this point in time, this bill, no matter what happens, if it is approved by the legislature, will enable the Guam Insurance Commissioner to regulate only rates that are, in some circumstances, excessive, so that under the federal rules, if the loss ratio for the individual and the small market falls below 80% of claims, then the insurance company is mandated to return part of the premiums that were paid in obtaining the health insurance coverage for the large or commercial market. The medical loss ratio requirement under the federal statute is 85%. I noticed that in the government of Guam, the experience ratio is 84%. So I have to appreciate that the negotiating team for government of Guam is getting better in that it was able to get a much favorable loss ratio experience than the requirement of PACA, which is 85%. In view of all the foregoing, and I will submit a written testimony to this effect, I support this Bill 131. Thank you, Mr. Speaker.
Thank you very much, Mr. Collis. Mr. Ilagan, do you wish to testify on this bill?
Yes, I do. My name is Art Ilagan. I am the Banking and Insurance Commissioner, and I am here to testify on Bill 131-34. The U.S. Congress passed and the President signed into law the Patient Protection Affordability Care Act, PACA, in 2010. It affected the Health and Human Services Act, the Public Health Service Act, and the Internal Revenue Code. All three acts had to work together for PACA to succeed. HHS allowed the advanced premium payments for taxpayers. The Public Health Service Act allowed for the essential health benefits, the medical loss ratio, the rate review, preconditioned ailments, mandatory health, individual health insurance, penalties for not having insurance, penalties for business not providing insurance for their employees. Citizens who were on welfare were to qualify for insurance using Medicaid federal funding. The IRS was the conduit to allow for the advanced premium credits, collection of penalties for assessed for not having insurance and for not providing insurance for employees. The Internal Revenue Code, the IRC, was also collecting the health provider's fee of 2% of any insurance companies that had made over $25 million in premiums. Not all three acts applied to Guam. The Public Health Service Act specifically included Guam. The Internal Revenue Code is included through the Organic Act of Guam, but the Health and Human Service Act only included the 50 states and the District of Columbia. Therefore, without the funding for PACA, the Obamacare administratively exempted Guam and the other territories from the ACA, the Patient Protection Affordability Care Act. This exemption prompted a study and a white paper by the National Association of Insurance Commissioners, and we went before the President, and he instructed his administration to look at the issues, and they administratively said it wouldn't apply to the territories. But in the law, it's still there. So the President can go back and change the law and allow all these acts to apply. I agree with the bill, but with the bill, we need an actuary, a person to measure the risk and uncertainty of insurance rates so that we can set the proper rate for the island of Guam. There are certain conditions of Guam that are not the same as the states, So if this bill was to pass, the rates have to be looked at for the island of Guam. Thank you.
Thank you very much. Mr. Moreland?
Thank you, Mr. Speaker, and for the committee for this opportunity to come before you regarding Bill 131. My name is Jim Moylan, and I'll be reading a testimony that was prepared by our administrator, Mr. Jerry Crisostomo. So thank you again for the invitation to submit testimony on Bill 131. Although I can understand the intent of the proposed bill, I am writing in opposition of the passage. I can also appreciate the temptation to go after insurance companies when trying to garner positive public opinion. They are the convenient so-called boogeyman because their high visibility and perception in the media as heartless profiteers. However, it seems disgenerous to single out the group health insurance industry on Guam as an industry needing additional oversight without first asking basic questions. Are the infractions this bill attempts to guard against an issue today on Guam? In other words, are health carriers on Guam engaging in unreasonable rate increases or excessive profiteering? One only needs to look at our filed annual statements with the National Association of Insurance Commissioners, the NAIC, to realize that the latter is not an issue. Now, with regards to unreasonable rate increases, you have to consider the group health insurance market locally. Guam is a hybrid, competitive environment with just 4 local carriers competing actively on a very limited pool of business. Because of higher fixed expenses, carriers need to maintain a minimum enrollment size in order to have a chance at turning a profit. Each health carrier has to balance this market share requirement with the need for sustainable rates. High or unreasonable increases will jeopardize the ability and to maintain adequate market shares because lost business is most likely to be the outcome than increased premiums. In addition, there's already a mechanism in place that requires health carriers to submit on an annual basis all policies and rates to the insurance commissioner for review and approval. The situation this bill seeks to remedy is absent on Guam, not because of any specific regulation, but because they don't make good business sense. Aside from being unnecessary, enacting this bill would also have an unintended consequence for increased costs. A health carrier expenses would increase in 2 significant ways. First, additional claims, cost uncertainty in the form of potential rebate. Second, additional reporting requirements, administratively and actuarially expenses as well. It should be self-evident that increasing carriers' cost is not a good recipe for bringing about lower health insurance premiums to the consumers. While the intent of Bill 131 is to ensure consumers' value and protection, it is equally important to remember that the government of Guam, through the insurance commissioner, must also ensure sound financial sovereignty of the health insurance companies. This essentially means that the premiums being charged by the health insurance companies must be financially adequate to pay for the claims incurred by the consumers and to ensure a reasonable profit as well. Additionally, the July 2014 decision by the Centers of Medicare and Medicaid Services that excluded Guam from this provision of the Patient Protection and Affordability Care Act, including the rate review and medical loss ratio requirements, was justified since other provisions of the law was not applicable to Guam to ensure the market's sustainability and premium stabilization. The question you need to ask, is the government ready to provide those protections in the PPACA that made the desirable provisions possible? Guam was excluded from these PPACA provisions for this very reason. Specifically, is the government of Guam going to mandate every individual and employer to purchase health insurance? And is the government of Guam going to provide the financial subsidies, such as the risk corridors, reinsurance, and risk adjustments necessary to ensure a more stable and affordable market for Guam consumers? In summary, 4 points. The proposed bill will create unintended consequences of increasing premiums and not achieve the expected goal of making health insurance more affordable. Desirability and the ability to invest and create innovative product offerings and improve healthcare quality for Guam consumers. Next, the proposal does not mandate or require employers and individuals to purchase insurance coverage. The medical loss ratio implementation can only be effective if individuals and employers are required to purchase insurance and financial penalties are levied against noncompliance. Third, due to the lack of adequate medical resources available on Guam, local health insurance carriers incur higher administrative costs due to the growing off-island referral contract requirements and coordination of care. And lastly, the bill does nothing to address the real drivers of health care cost and affordability. I want to thank you for the opportunity to share our thoughts and concerns, and we look forward to a constructive decision on this very important health care issue. Thank you, Mr. Speaker.
Thank you very much, Mr. Moreland. Ms. Mendiola, do you wish to read your statement, or are you going to just submit? Just submit? Just submit. Okay. Thank you. So we'll note that Staywell has submitted testimony. Mr. Campillo.
Thank you, Speaker. Good afternoon, members of the committee. We have written testimony. It's rather simple. Dear Speaker Cruz and members of the Committee on Appropriations, thank you for giving us the opportunity to testify in reference to the aforementioned bill. At the onset, we support the spirit of the bill on both rate review and medical loss ratio. We also look forward to working for the Insurance and Banking Board in the development and implementation of sensible rules and regulations pertinent to this bill. We will also like the committee to know that cost and affordability of insurance premiums is a goal that the Affordable Care Act has not only missed badly, but it will clearly not achieve it either. The ACA, as you know, may not survive either the President's attempts to repeal and replace it or Senator Sanders' work to replace it with Medicare for all. What is evidently clear is that the ACA is not working and will not meet the objectives for our fellow citizens in continental USA. Ergo, we caution the committee on moving forward and implementing parts of a law that has clearly shown to be flawed when measured by the attempts to replace it both by Republicans and Democrats in Congress. We will be happy to provide any clarifications that you may require. Thank you very much.
Thank you very much. Maureen Sablon, do you wish to submit any testimony? Okay. So on 131, that's all I have. Anybody else wish to testify on 131? If not, I'll open it up to question. You may pose your questions now, Mr. Chairman.
Thank you, Mr. Chairman, and thank you very much for all of you for your testimony, for being here this afternoon. Mr. Logan, I got a question. The annual statements of health carriers that is provided to the Banking and Insurance Commission, that's required by law. Is that correct?
Yes, it is, and it's not just with our department. It's also filed with the National Association of Insurance Commissioners.
Okay. So is it safe to say on those, on the reports that you receive, you have there where the total premiums for their small, what's it called, the small group, and the total premium from the large group from each company, and then you have the incurred expenses, the claims, right?
Yes, they're
so
in there.
If you, just to be very simple, so if you take the premiums minus the claims, would you say that's a safe way to estimate what the profit would be for that carrier?
If they reported it properly, I would assume there would be.
It would be. Okay. So I just want to address one of the testimonies by Netcare. There was you asked a question in your testimony. In other words, are health carriers in Guam engaging in unreasonable rate increases and/or excessive profiteering? And I don't know. And that's a good question that we can try to answer. And we can find the answer out. But based on the reports that were filed with the Insurance Commissioner, at least in 2016, you see that cumulatively there's about in excess of $30 million in profits. If the Insurance Commissioner says that you take the premiums that are reported minus the incurred expenses, and you can see that that is pretty much the profit for the carriers. So if you take a look at the data that is presented, right, that's the information we have, at least for 2016. Cumulatively, you have about $30 million in profits. And, we're not here to talk about the benefits that the carriers do have now with their qualifying certificate and the great benefits that is provided to the industry. And really, this is not an attempt to go after the industry. And believe me, I want businesses to make profits. It's not about that. It's about being able to work together and being able to be reasonable and fair, right? And so there's a reason why this provision is part of the federal law. Sure, we did as a community go to the federal government and say these provisions should not apply to Guam, but it doesn't stop us as well to implement and establish this locally in our local statute. So I look forward to working with the industry on this measure and all the other two bills that we have before us. Thank you, Mr. Chairman.
Good afternoon, Mr. Speaker, Senators. Thank you for this opportunity to give our testimony as well. I just wanted to seek clarification as well on the purported number that was mentioned, indicating a $30 million profit for the healthcare industry. We would like to learn more about that information. That's certainly not consistent with what our own review has shown us. And speaking from our side, a relatively smaller carrier, we also would like to stress that when someone makes a statement that someone is profiting too much, what exactly is the appropriate profit? What exactly is the amount that you would consider as too much? We have several industries in Guam. We're part of one sector. We have others in the health sector whose expenses and profit are driven by the way they are allowed to conduct their businesses. If I were a hospital, I could charge certain items or supplies up to a certain markup. If I were a supplier of medical equipment, I could do the same thing. But for the health insurance industry, what would you say would be the appropriate level? And if we looking at it from the actuary point of view, when you have your surplus for a given year, you also look at several years, because you may be doing well in one year, and then the following year may be different. Now, it's specifically concerning for the Guam carriers because us as a smaller player, we don't have the economies of scale, we don't have the ability to possibly recover if a catastrophic condition would impact our performance on a given year. So certain years you may profit, and you can use the profit amount to boost your reserves so that in the following years, depending on the performance of your portfolio, you can have a buffer to protect you from catastrophic claims or conditions. So just pointing that out, Senators.
And if I may, Senator Rodriguez, concurring with what Anthony said, we don't see $30 million of profits in 2016. Please understand that some of the statements filed include other lines of business. For instance, Netcare, that's life insurance as well. So it includes their life insurance portfolio and the health insurance portfolio. So I don't know if they're looking at the gross premiums, which include both, or just specifically health. And for our side, our insurance carrier, Tokyo Marine, includes auto, homeowners, and the different other property and casualty businesses that they write. But I can tell you that I don't see $30 million of profit in the entire industry. In fact, even half of that is not the amount.
And I just want to ask a question to the chair. Is that public information, that the statements that are filed?
It's proprietary. It's like a tax return. It's not public.
Okay, well, we got to figure out a way to come to where to ensure that I can substantiate my statement. So we'll speak to them, and if that's something that we can share, then absolutely, that we'll share that.
Mr. Chairman, the profit that is allowed the insurance companies for the individual and for the small market is on the basis of the medical loss ratio. So for the individual market, as well as in the small market, they're allowed 20%. For the commercial and large market, they're allowed 15%. That's why the medical loss ratios are set at 80% for the individual and the small market, and 85% for the large and commercial group. So that's, to me, those figures or percentage as set by the Affordable Care Act and by the regulations thereon are reasonable. Whether or not the insurance companies are able to attain or exceed those parameters, it cannot be disclosed because, as the Commissioner says, those are proprietary.
But point of clarification, John, if I may, the 20% that former regulator John Carlos and 15% that he talks about is not profit. It's the total retention that an insurance company is able to hold. And from that, you pay for your power, for your rent, for your employees, and then you hope that you will have some profit. I can tell you that from my guesstimates are that the margins are significantly less than those stated, far less than those stated. Yeah.
And I'm going to raise my hand this time. So the term profiteering is actually in your bill. So I'm referring to the profiteering in your bill. We're a private enterprise. We're supposed to make a profit. If we don't make a profit, we're not sovereign. And if we're not sovereign, these guys are going to tell us, go sell hot dogs on the side of the street. We're supposed to. We're supposed to do a profit. We're supposed to grow our business. We're supposed to come up with innovative new plans and objectives. The loss ratio that we're talking about, if we refer to it in government of Guam, it's 86%. So 14% is left for us to pay for our bills and to keep our stuff in reserves. But if my market in government of Guam isn't large enough, if I got a group of employees that aren't healthy enough, I'm going to far exceed that. Maybe my competitors have a healthier group, and then they should be. But we can never determine who's going to get the better cut of the pie, right? So going back to that and going back to Mr. Ilagan's talking about, we're highly regulated. We do these blue books. In addition to that, we get auditors come in after we pay for our own auditors. Then the government says, oh, by the way, we want another audit. We could have simply given them our audits, which we pay for. Then we pay for the government's audits. And then there goes our peanuts of 14% after you pay for increased utility bills, after you pay for increase in salaries, and we can go on and on and on. But if we keep on raising our prices, the consumer's going to say, never mind, I'm going to go drink Lagua now because there's nothing that will affect my kidneys on that. So please consider these points. We fought for for the federal regulations not to apply because it's going to cost the government more money again. Let's not do this, please. That's all I ask. Thank you.
And just one more, Mr. Chair. So no, I said earlier, I totally agree that you need to make profits. Businesses need to make profits. And I think the government of Guam, the people of Guam have been very clear on that, at least for your industry. You've had a very generous qualifying certificate over nearly almost 20 years now. And these things automatically, I understand, automatically renew for another 20 years. And so the people of Guam support the statement you just made that we want you to make profits, but we also want you to be a partner, which really, for the most part, you guys are partners, you know. And so we can just move through this. I know that this piece of legislation was really, you know, we want to bring it back up in our discussion with the expansion of health insurance. That expansion of health insurance, we're looking at funding it through a fee, tax. You know, some people call it tax. It is a tax, and if you want to refer to it as a tax. But that's where we want to ensure that there is protections as well for our people, that if we do move forward with that piece of legislation, which we're hearing next, that there's no unreasonable rate increases if we do take that path. So thank you, Mr. Chair.
Thank you. Art, did you have something you wanted to contribute?
You know, part of the problem of the hospital is patients that don't pay. That's a major portion of why the hospital is not surviving. They're sinking. It's because the payer mix that goes there are the people that can't pay. So if there is some insurance that they can apply for through these insurance companies, at least they have something that can pay the hospital so that they can survive.
All right. Do you have any questions? Why don't we start with this vice?
All right, thank you. Thank you all for your testimony. Mr. Logan, I wanted to confirm, so on the first part of the bill about the rate review, you support the rate review annually? That's
It should be done. It's
okay.
Not something that should be supported.
All right, but it's not done yet. It would be done pursuant to this bill, right?
There's certain mechanisms that need to happen for locally, like hiring our own actuary to look at the rates, to look at all the requirements, to see even if the 20% or the 15% is the figure for Guam.
All right, and this bill seems to allow use of funds from the enforcement fund to hire an actuarial for your purposes, and to impose a fee for this review, I guess, on the insurance companies, and that's how the actuarial would be funded. Is that correct?
I believe Senator Rodriguez, about a year and a half ago, sponsored a bill, and it was passed where part of the cost of insurance, banking, securities, part of those fees would go into this fund to fund the operations of insurance and banking.
Okay. This group talks about studying the market rates, and I'm wondering what would be included there. Do you think that will require the annual rate filings? Is this, for example, small groups, large groups, individuals?
Any insurance companies that charges for premiums, the rates they set should be through PACA, through the federal law. It says 10 or 15 or 20% is for their operations, and 85 or 80% is for patient care. So here in Guam, we're kind of in a different market condition. So the cost of somebody going to California to get an operation is very different from somebody in California getting an operation in California. So those things are taken into account by somebody who can properly measure the risk and uncertainty of insuring patients.
All right, but you would agree that this bill then should cover all all customers, individuals to large groups, I mean, all of them?
It does cover everything.
Okay.
Just a point of clarification, Senator. There is no individual market on Guam right now. Nobody sells individual policies. And there is a huge part of the population that is asking for that. But part of the problem is exactly some of these things that this will discourage any one of us to even try to sell individual policies.
Why is that?
Once again?
Why does this bill discourage individual policies?
Well, because first, nobody's in that market right now. The market has become, it's one that the insurance industry believes that is very volatile, number one. And number two, if you got to comply with more requirements, evidently you probably say, no, it's a market that I don't want to get into. For instance, what Jim alluded to in regards to the fact that we go through our internal regulated audits.
Yes.
And now, just recently, all the 4 companies that are on Guam have to go and pay about $120,000 for a regulator that is reviewing all of us currently. So the more cost for these regulations, or the more cost that you add, the less chances one individual company will consider to get into an individual market. So I'm already telling you that as it is.
Yes, okay.
We feel that there's a lot of barriers, and there is a market that right now is not nobody's feeling that void.
All right. Does this, do you think that this bill would cover the plan that's envisioned in Bill 132, that healthcare para todo plan, in the other bill? Is that something else that would be?
I didn't read that of the bill. I only got the notice for this bill, so I don't know what that bill is.
What about?
But going back to the individual market, if that's not mandatory, only the sick, because there's also the pre-existing condition. If you are well, you're most likely not going to get insurance. But when you start getting sick, it's when you start looking for insurance. And when this law was passed by the states, it allows no pre-existing condition. So you have to have insurance. You have the market has to sell insurance to everybody, not just to the sick. Back in 2003, I believe, or in the early 2000s, I remembered one of the insurance companies who opted out of Gov Guam insurance because all the sick people were with them and they couldn't afford to keep on with the Gov Guam contract, so they pulled out. They filed suit against the government.
All right.
Senator,
yes.
if I may, too, we were talking about regulating the insurance companies, but where our real cost comes from is our providers. They're the ones who are setting the rates. We go to all these providers, we all have contracts with all these providers, they set the rates. We try to negotiate saying, hey, we got all these people. Here's a common rate that you should follow. Some of these providers say, no, thank you. We're not interested. We're going to have your customers pay cash. You seek reimbursement. It's up to you if you want to pay our rate or not. We don't care. We have a unique market on here. You can't drive to the next state. You got to do what you got to do here. That's one of the real sources or the problems with increased cost of health care. What is that provider charging us as customers? If you want to regulate us, we should really look at regulating doctor, dentist, whoever, right? But they're the ones charging the bill.
Okay.
Thank you.
All right, and then on the medical loss ratio section, Mr. Logan, first of all, I thought I heard somebody say earlier, maybe it was you, that of course, government of Guam has this 85-15 ratio, right?
Yeah, it's in the contract.
And does the federal government require that for your participation in their?
Thank you, and I'm very happy that you bring up Gov Guam. And the federal government also has a medical loss ratio, but it's a little more fair than Gov Guam. Let me explain to you why. Gov Guam is actually 86%. You only retain 14%. If you, for instance, if your loss ratio is 107%, the next year you really don't have the opportunity to recover anything. With the federal government, you actually are given a 5-year average. So it's a little more fairer, number one. Number two, it's not actually 85% John and Art. It's less than that. The ACA gives allowances for what is called quality improvements, which Guam does, and also. So in that regard, I actually would like to see Guam see a proposal to include quality initiatives as part of the reduction of that 86 and have that also allow for. Otherwise, you don't have enough sufficient income to be able to have high quality initiatives for this population. So the federal government gives you a 5-year rollover where you're able to average, and also gives you quality initiatives, which is another percentage of the expenditures. You know, so it's not, the Guam is very rigorous. That 14% is very, very difficult to meet, you know, and I don't think everybody on this table makes money on that market. You know, so.
I was wondering if the way this bill's written seems to follow that federal, or encourage that the commissioner is going to follow that federal formula in coming up with the reductions from the 85 or 86%, right?
Which is one of the reasons why I said in my statement, we support the spirit of this law. The spirit, as long as when it comes to the regulators, that they actually implement it in the manner how that particular loss ratio is written.
It's supposed to be done. And you support that? The complicated formula versus the simpler formula on the Guam, I would call it simpler, I guess. Less
I would refer to it as unfair formula of Guam.
more restrictive formula, yes.
No, that rate has to be what Guam can afford. Because again, like they said, the doctors or the providers are the ones setting the fees. So that's what they go to see how much they can charge for rates.
Do you think that the dental and the vision insurance should be subject to this bill also, or just medical?
I don't think it is. I can't recall if most of it is in the medical side.
Do you think it should be? Do you think it should be?
In my opinion, I really don't know, because I really don't spend that much on.
Do you have an opinion already on the percentage that you think is reasonable?
Actually, that should be done by an actuary.
Okay. And like you said, there should be accommodations made specifically for Guam.
Yes.
Okay.
I'm sorry if I may, on your question regarding if the other folks should be regulated as well. Well, to be fair, possibly, but I wouldn't agree to that either. I think the market should regulate. Your consumers are the ones that would drive the cost. The consumer loves that price or loves that service, or it doesn't matter the cost. They're the ones who would regulate. Just like us, the insurance companies. The consumers are going to come to whoever is best in service or in product or affordability, and we can determine that by the group of coverage that we provide, by the people that we insure. If you allow us to do that, we're domestic companies. We're here to stay. We've been here 46 years, 20 years, 50 years. We've got no place else to go. We're not going to leave the island. If we left the island, it's not going to be to sell insurance. We're here long term. In the mainland, you can decide, oh, California got too many fires. They got these health issues. I'm not selling there next year. But I have all these other states I can sell to. In Guam, we're in basically all the islands too, but that's it. That's our small pool. If now you're going to tell us that our profitability is you're limiting that to us, why are we doing that? We're domestic. We're here to stay.
Do you think that, thank you, I appreciate that. Do you think that this will be applied in addition to what's applied in the Government of Guam contract, or, I mean, is that going to supersede it or supplement that?
I don't get the question. Are you saying that we should apply what we apply to Guam contracts to everybody else?
No, just this bill. Does this bill, I guess maybe I should ask the author, is it going to supersede what's being applied in that Government of Guam contract?
Well, the Government of Guam contract is a contract between,
I guess
it's a contract.
Can't be changed, so, all right. Okay, and all right. My final question is, this bill is supposed to be, well, there's certain parts that are supposed to be implemented in 60 days, and do you feel that that's reasonable? It looks like a very
It's a very
labor-intensive bill
It's a
too.
very tight time frame. I think it says implemented or upon enactment. We need the actuary. We need the study to be made on the island.
Who would do this work for the commission?
If we can't find locally, we contract out.
No, I
That's
mean,
what-
not the actuarial work, but the rate review work.
Even that's done by an actuary.
Oh. All right, so this would require you to hire an actuary, but you don't need additional staff or anything like that?
Well, we haven't done it yet, so we may need staff. It's very cumbersome. A lot of work to be done.
All right, yeah, it says that the rules and regs have to be done in 60 days. That would be done by, you need an actuary to do that also?
Yes, we do.
All right, okay, thank you very much.
Thank you, Mr. Chairman, for allowing us here today, and thank you for attending. A couple questions. I'm taking a look at the bill, and I'm taking a look at it with the macro view of both the business model and the market and the uniqueness to Guam. And I understand from the business aspect, you know, I agree on many, many parts that the consumers drive the prices. They make the determination and doesn't necessarily need to be regulated at a government level. You know, however, there are a couple of things that we do need to take into consideration. It was mentioned before, and I won't drag it on, that there are large subsidies, not necessarily subsidies, but QCs applied to the insurance companies. So when looking at the market as a whole and applying that knowledge to what we're trying to do here, you know, the question really comes is the market even viable if the 4 insurance companies that we had on the island weren't allowed those QCs? So if the profit margins are low to begin with and minimal as being stated here, and the QCs weren't provided by the government to the various companies, is it a viable market? And so when we look at that and we look at the limited pool of customers, when we look at the limited pool of providers, and when we look at the support provided to the insurance companies by the government, obviously questions come up that the survivability of the market itself would be in the best interest of all 4 to work together. And so not having any idea of how the rates are derived and without a proper review, the question will always be there, is there collusion? Because while I agree with the sentiment that there are 4 of you, that the market will drive, the consumers will drive, and that it'll be fair competition, and that's what we'd hope for in businesses, that it's a fair market and that competition drives the regulation of the market, we also have to understand that we're in a unique market where you're telling me on one end competition will drive and it'll regulate itself, and we should just trust in that. But then on the other token, you know, very skeptical whether it's a viable market to begin with and whether 4 insurance companies and carriers are too many. And so when issues come up of a lack of visibility in terms of regulation and oversight into what those rates are, considering the necessity on the island to have insurance and have health insurance, you know, the question comes up. So from my point of view, the way I look at it from a macro level is really more information. I look at the bill as providing more information, because while I trust, and again, I don't contend with the integrity of anybody on the panel, when you're telling me that your profit margins are low and that your rates are as low as they can be, I would like more information, and I think the consumers would like more information. Similarly, do we do with the public utilities and the PUC, that it looks at rate increase and adjustments? Only because we've gotten to this point where health insurance is a big factor in health care overall. And it's an unnecessary, I don't want to say unnecessary evil, that would be unfair to what you guys do, but it's a necessity to our form of medical care and our medical systems in the United States, to include Guam. Again, I understand, as you're saying, and you guys seem to be speaking on the same page in terms of this would discourage an individual insurance market, which I do understand. But again, at the macro level, wherever there are gaps in businesses, others may arise. And so, again, it's a balancing act of whether, how far do we go in government to support 4 individual agencies which we want to be competitive, but at the same time not supporting the idea to ensure that they're trying to remain competitive without, because for what it is as it stands is just word of mouth. So, yes.
So may I thank you, Senator. First, a point of clarification. We're not receiving subsidies from the government of Guam. Let
me correct the statement. I don't mean subsidies. I mean the qualifying certificate.
Okay, so the qualifying certificate basically says that there is a GRT abatement, right? But that also means that the GRT is not being paid by the consumers. At the end of the day, those taxes will ultimately be paid by the consumers, which means it's a 4% savings that the consumers are seeing today in health insurance. Because if that 4% needed to be implemented, clearly that has to come from the consumers, number one. Number two, the perspective of competitiveness, I can tell you that, yes, there's four of us, we don't get together on, because we are afraid of that being seen as collusion. The fact that each and every one of us, with the exception of the government of Guam Memorial Hospital, which has a standard contract for everyone, every one of us have very different contracts with providers, I assume, because we meet individually with each provider, and each provider or each individual gets rates that each of us can think we can afford. So from that perspective, that we have different rates with each and every one of our different providers tells me that there is no collusion in that area. The fact that the premiums in Guam are about 50 to 60% cheaper than what they are in Hawaii or continental America, and that's a fact, 50 to 60% cheaper than continental America, in a population that has even higher possible degree of illnesses and comorbidities than in many other populations in America, tells me that we're not colluding, tells me that we're very competitive, tells me that we work very hard to keep those rates as low as possible.
And I appreciate that. And again, in many respects, again, I'm not accusing you of collusion.
No, and I realize that.
In our duty, though, our fiduciary duty and really our moral duty to the people of Guam is at some point there's the request that we just know. And when I look at the rate review would be, I think the impact with that, what we're looking at is either one, we apply the administrative costs to you guys for this, which I understand, which will potentially get passed on to the consumers. And the question becomes that, as I'm viewing the bill, is that additional price that's going to the consumers, that to be paid for by the consumers, worth the information? And that's what I'm trying to weigh right now.
Yeah, and thank you. So let me clarify further. For instance, rate review. A significant part of the market in Guam is called Guam, okay? And that rate is already being reviewed. That's the reason why you have negotiations with the negotiating team. They review our proposals and everybody else's proposals in regards to how much can you charge or should be able to charge. We got to validate those charges based on utilization, based on medical loss ratio. So that portion already is being reviewed. Then you have the federal government. We got to submit the requirements to the federal government. So now the rest of this is really only for the commercial market. And I can tell you that the commercial market in Guam, the rates that are being paid by the commercial market in Guam are about 65 to 70% cheaper than Hawaii or continental U.S.
Now,
that alone tells me.
Now, can you at least maybe summarily try to maybe explain why it's lower? I mean, I have an idea, but I think if maybe you'd be able to apply some note. I know one of the things unique about Guam with respect to, and you had mentioned providers, they determine the rates. But one thing unique about Guam are arbitrary laws, which really eliminate a necessity for malpractice insurance, which to my assumption should really decrease the rates and the fees that these providers are charging, because there are protections in statute that protect them in these types of situations, because of our unique situation out here. Is that something related to why the rates are lower?
Yes and no. The way we view the reason why rates in Guam are lower has been the fact that we shifted the utilization from about 10 years, up until about 10 years ago, the market was utilizing resources for specialty care in Hawaii and California. That has shifted. That has gone to markets where
the Philippines,
the cost is significantly less, and that has helped quite a bit. In fact, our concern, and it's the concern of all of us today, is that while we support more medical technology on Guam and more medical specialty, is that the more we now retain utilization of services on Guam, the higher the price is going to be, because those people that were going to the Philippines, for instance, are going to remain here. And there's a simple equation. A room at GMH is costing about $900 a day. A room at GRMC is costing about $1,500 a day. A room at St. Luke's, $100 a day. So just in that perspective, you'll see why our rates are significantly less. And that's because of the utilization of the Filipino services. If that changes, and it's changing rapidly, you're going to see rates increase. Yeah.
And definitely those are things that, we consider. And again, from my point of view, at the macro level, again, there's the balance. The $2,400 a night at GMH versus the $100 at St. Luke's is still potentially $100 that can remain on island. And that's not to argue, the people are getting the care they need. That's the most important part. I just want you to understand some of the things that I'm trying to rationale as I'm discerning the bill. And I'll be looking to you guys for more information. I'm really torn about this. And I do understand the business side that you guys are coming from. But again, I'm always of the view that more information is better for everybody. It just depends on whether or not we want to pass that cost on to the consumers, potentially by trying to get that information. Thank you for your testimony. Yes?
Senator, please, if I may. So we're a profit company. We're all friends on the table. But when we're out there,
we kill each other.
We kill each other. Man, I'm looking out there to see, Frank, I'm going to give a better performance than you. I'm going to take your customers. You can't take my customers, whether it be on the commercial side or how big of a market I can get in Gulf Guam. I'm selling myself. I'm being the guy on the street corner. I'm just selling me. What's going to sell me is my prices. I better have a better price than Frank or a better service than my other competitors. Because if we're too close together and I don't sell myself enough, I ain't going to get the guy to switch over to me. We're competitive. We had to sell ourselves. They're not going to come to us unless we really sell. We make them believe, and price is a big object. If I got a better price because of how I administer my policies and how I service my policies, more power to me, right? If Frank has a better price, or Staywell got a better price, or Take Care got a better price, better for them as well. What do we have to offer? But when we're out there, we just go and we kill. We're kind of nice about it, but we still try to kill each other to get those consumers to come on over to our side. And when we talk about QCs, that's great. It's because you wanted us in the market. It's because we need to do that. We build our companies. We hire local people, like the hotels. They got their QCs too. They're providing a service that makes the market go round. Likewise for us too. So we're regulating ourselves. We're doing our best to be better than our competition so we can make the next sale as well. At the same time, we still go to happy hour together. We're still nice to one another. But please just consider that in your, for this bill.
Thank you again, and thank you for answering my questions. And again, I just want to leave it with that. My primary concern is that there's competition in the marketplace. Yes.
I'd like to say something to that. I'm actually in a position where I can attest to that because I ran a company. I had 206 employees. I paid 100% of the employee premium, and these gentlemen sent their representatives over to my company to compete for our business. Our employees had all been covered under medical care for extended periods of time, so we were an ideal candidate for all of them, and they competed very aggressively. There was a lot of competition. There was a wide range in benefits and premiums and everything, and it took us a while to settle on which company we would go for because the competition was so vigorous and there were clear differences. I mean, when you look at the proposals from the different companies, there were clear differences across the board, and that was because of what I will testify to later. It was mandatory in our company that we paid 100% of the employee share of the employee coverage. We covered 100% of our employees. And because we had been doing this for 15 years, we had a body of employees that had been under continuous medical care for extended periods of time. Now, we had turnover, not very much, we have maybe 2 to 3% turnover a year. So as a result of that, the insurance companies were able to compete very aggressively, and they gave us very attractive rates because of that extended care history. They weren't taking on a company that was a basket case, and they knew it. So I just wanted to reassure you that the people sitting at this table, they may not play golf together, but they do cutthroat competition with each other.
Thank you. Thank you, Mr. Chair.
Thank you, Mr. Chairman, and thank you all gentlemen for providing testimony today. Mr. Leon Guerrero, I agree with you that local data is extremely valuable, and I really appreciate that aspect of this bill. I think I have some questions for the Banking and Insurance Board. Mr. Logan, if you're able to just comment on the rate review. I think one of the important parts of the rate review is to protect the public from unreasonable rate increases. And so I just wanted to ask you if the Banking and Insurance Commission might consider if there would be public input or how the public would be involved in the rate review process.
Rate review is done by an actuary. They look at the risk and the uncertainty of companies. Take, for example, Mr. Ken Leon Guerrero. He had a history of being insured. So, of course, they're going to give him a better rate. So you have to look at the uncertainty, and that's what the purpose of the actuary is.
Right, and in Section 5C, later on in the bill, it said that available funds from the Banking and Insurance Enforcement Fund may be expended for the purposes of this section. So that would cover the actuary that you're talking about. Is that correct?
Yes, that was again a bill by Senator Rodriguez about a year and a half ago. It was to put some money aside from the licensing fees of banking, insurance, and all the other fees that come through the insurance and banking section.
Okay, and are you familiar with how much is in that fund currently? What's available now?
Right now, I think there is probably about 200,000. That's accumulation of years, because we haven't. For us to spend that money, it has to go before the banking board for their approval.
Understood.
So we had a banking board meeting last week, so part of it is being used for some items.
Okay, and just for my information, for maybe the listening public, how many members on your board are currently employed by an insurance provider?
I believe there's 3.
Out of how many?
There's supposed to be 9, but it's hard to fill the attorney
right.
Position. So there's 3 banking, there's 3 insurance, one Guam employee, one lawyer, and one person, anybody, public person.
Okay, thank you very much. Mr. Moylan, in your testimony, you mentioned in the 3rd paragraph, in addition, there's already a mechanism in place that requires health carriers to submit on an annual basis all policies and rates to the insurance commissioner for review and approval. Can you just expound on that mechanism and how?
Our policies can't be sold unless the insurance commissioner approves of our policies. So first must be approved, then we can provide our public. Their position is to protect the public and to ensure we're doing the right thing and providing the services that we're supposed to. They say yes, and especially in Guam, the most recent one, some of our presentations were delayed because we're waiting for the insurance body, and there were some back and forth, some questions. They were really diligent about what they had to do before we can do our presentations to Guam employees. So it goes before them, they approve, stamp. If we sold something not improved, we're in trouble.
So you submit on an annual basis and then you wait for them to review and approve. Is that correct?
Annual basis, I'm not, well,
Before, if I may clarify
Yes.
that for him.
Sure.
Before any new policy is sold, you got to get approval. And that approval includes the rating parameters of that policy, basically. So before any new health plans are sold, if you come up with a new health plan, a new policy, you got to have that reviewed by the insurance commissioner,
So that's
along with the rating mechanisms for that policy.
So that's the health plan in total, but should you choose to increase or decrease those rates, that doesn't need to be approved by the commission. Is that correct?
Well, again, but thank you very much, Mr. Leongoro, for being here. He may not look at those rates, but the person who's renewing those policies, I can tell you that, you're increasing my rates by this much, and that is basically based on utilization. I'm going to go to the next guy. So, in essence, you're getting rate review by the public more than even the regulators because, as he says, I'm going to the market and I'm going to look for the best option for my company based on rates and also based on the services that you provide. So the public also is being engaged in reviewing our rates.
And Senator, if I may, when we do our rates, we have an actuary on staff.
Exactly.
They determine by the loss ratio of that company, what's the best rates we can provide. We have all our marketing people that said, make it lower, make it lower, make it lower, because we're going to go out there and we're going to compete. And if our rates aren't right, what do we waste our time? So we want to get the best rate possible to attract that market, see how well they utilize it, and if rates have to be adjusted later because of certain situations of that group of business, it has to be supported with a rate increase. If we increase it too high, they're not even going to entertain our proposal.
Understood. Okay, thank you very much, gentlemen. Thank you, Mr. Speaker.
Thank you. We'll consider Bill 131 as heard. We'll now move on to Bill 132. Eric, did you have anything to come on 131? Okay, 132. Mr. Pinsky, you want to come up and join the table?
Thank you, Mr. Speaker. Senators.
Thank you, Senators.
No, all the rest of you can stay. I think you wanted to testify on the next one, right? 132?
I signed on the wrong form. I didn't know there were 3 bills. I only got 1 bill for...
Okay. Well, there's 3 bills today, and so 132, Mr. Ken Leon Guerrero, Darrell Taggarty, John Carlos, Frank Campillo, Maureen Sablon, Anthony Mendola, and Mr. Pinsky. I guess they're just going to submit. Did they leave? Okay. Go ahead.
Okay. Thank you, Mr. Chairman. Mr. Chair, Bill 132 is basically a Medicaid expansion bill. The model we use is the employer-sponsored insurance and premium assistance model. The government of Guam will be required to apply for a Medicaid 1115 waiver to complete this pilot project in support of this program. This approach uses Medicaid dollars to pay the employee share of premiums to employer-offered private health insurance coverage. The target demographic in this demonstration is the 109% to 200% of the federal poverty level. How this works, Mr. Chairman, is that there would be a combination of resources that would pay for this. Because it's a Medicaid expansion, 55% of the premiums would come from the federal government. The remaining 45% is the government share, and from that 45% share, the employer will be required to pay 65% of the premium. The employee would also be required to contribute via health savings account no more than 2% of their annual salary. And the government of Guam share from that, the remaining would be coming from a fee. The 4% fee that we talked about earlier is the equivalent to the 4% GRT tax that the insurance companies don't pay for because of a qualifying certificate. And so, Mr. Chair, this bill facilitates, as part of these programs, options, a mandatory health savings account, a function for beneficiaries. It also ensures healthy behavior incentives are included in the proposals. And it also provides, it requires employer mandate. In order to meet the goals of this pilot project, the need to have employer mandate shall be evaluated. And we also have a section in this bill that will provide some sort of incentive to small businesses for them to be able to afford to be part of this program.
Thank you. And so Bill 132, we'll start Mr. Leon Guerrero and Mr. Taguity.
Okay, my name is Ken Leon Guerrero with Guam Citizens for Public Accountability, and I'm testifying in opposition to Bill 132 and 133 because I think it's the right thing to do, but I think it's taking the wrong approach. Back in 1974, the state of Hawaii, an island economy, saw the problem of health care coverage a long time ago, and they passed a law making it mandatory. Health insurance coverage was mandatory for companies that employed 5 or more people. And as a result of that, today, Hawaii has the second highest coverage in the United States at 93%. One other state, I think it's Connecticut or Massachusetts, is at 97%. Now, the reason I say it's the wrong approach, because here we're going to be taking Medicaid dollars, and even with the doubling of the poverty level, we still leave a lot of people uncovered. And the reason I bring this up is because during my work, I've run into a lot of people who work for businesses. You know, I mean, one person came up to me, she's a professional in a doctor's office. They don't provide any medical benefits. So she and her husband got divorced so she would qualify for Medicaid. You know, it's an unfortunate situation that here on Guam, that businesses who want to provide medical benefits can't because the business environment is so competitive because it's so small. We're talking about a workforce of 68,000 people. And we're talking about the fact that 1/3 of those work for government of Guam or the federal government. 1/3 of those work in the hotel industry. And many of the hotels, they structure their jobs so that people don't qualify for benefits. And that's why you have people that work in the hotel industry that work 2 or 3 jobs to make a living. That way the hotels, even though they have medical benefits, can avoid paying it. In Hawaii, it was mandatory. You have 5 employees, it didn't matter, full-time, part-time, you had to pay 50% of the employee's coverage. Right now, that is $268. When I was working in Hawaii, it was $75. So from 1974 to 2017, the employer share has gone from $75 to $238. During that same period of time, a Burger King chicken sandwich meal has gone from $1.99 to $11.75. So that program obviously is working in Hawaii. And because so much of the Hawaiian population has reason to go to primary care providers, the increases in the cost of medical procedures in the state of Hawaii has been single digits for years. So in the time right now we're in the United States, depending on the location, medical expenses have gone up between 25 and 33% in 2015. In 2015, the cost of medical procedures in the state of Hawaii went up 7%. So getting more people covered works. Now, the governor proudly proclaimed that the problem with Guam Memorial Hospital is that 7 out of 10 patients don't have coverage. So why don't we fix that problem? Let's make it possible for 7 out of 10 patients to have coverage, which making it mandatory for the employers, as opposed to some hybrid form of tax increase and using government funds. Because When I talk to business owners, they're willing to provide medical benefits for their employees, but they can't afford it, because if they provide medical benefits and this guy over here doesn't, then I'm going to go out of business. So that's one of the reasons why we see so many business owners on Guam reluctant to provide medical benefits, because it's not a level playing field. We have a small economy. It's only 212 square miles. It's not like we have people driving across the border to get medical benefits here on Guam. So we have a fairly stable, homogeneous population. And if medical coverage, if we had universal medical coverage as opposed to universal health care, there's a difference, because like you said, we have 4 companies here that are very competitive. The problem they have is finding clients that are willing to pay for medical benefits. Now, if every single company on Guam that had 5 or more employees was required to provide a minimum level of medical coverage, and every company was required to pay 50% of the employer premium, that would be a level playing field, and I could offer my employees medical coverage knowing that he was going to be forced to too. And the only competitive advantage he would get is if he was able to negotiate a better plan with one of the 4 companies than I am able to. The way I look at this program right here, we're shifting massive amounts of government revenue to support the insurance companies when it's not needed. Because if we had that mandatory health coverage, we wouldn't need to transfer money from government programs to commercial providers. We could use the money for the government programs to improve the government programs for those employees who legitimately qualify for Medicaid and MIP, and probably reduce it, because how many of the MIP and Medicaid people have jobs, but they're on the program simply because they have families and they don't have coverage through their work? Well, I know 2 personally, right off the bat, that if they had medical coverage through work, they would be more than willing to pay the 50% their share, and that would take 2 families off Medicaid. And I'm sure that when we look at the rolls of Medicaid, there would be a lot more people that would come off, which would reduce the cost of the Medicaid. So that's the big concern I have, because when I look at this program, we're going to be transferring government money to commercial programs, but there's no guarantee that the commercial programs are going to offer as good a plan as the current Medicaid and MIP offer now. There's nothing that says you cannot go less than the current benefits offered under Medicaid or MIP, because when you take this money, move it to a private carrier, then they're going to have to add their overhead on top of it, including taxes and profits. So they're either going to reduce the benefits that they offer through this hybrid plan, or they're going to have to raise the premiums, or what they will do is dramatically increase deductibles and co-pays. Now, when you consider that the majority of people that went on to Medicaid and MIP, the concept was they were lower income. Right now, MIP and Medicaid do not have deductibles and co-pays, to the best of my knowledge. So what's going to happen if we start throwing deductibles and co-pays? Well, I'll tell you, when I made the transition from my plan to Government of Guam plan, I was shocked, because I went from a plan that had no deductible to a plan that had $2,500 deductible, and that hurt. So if we're going to take people who have low income, so low that they qualify for Medicaid and MIP, where are they going to get the money to pay for the deductibles to see a primary care physician? They won't. They'll still go to the emergency room as their primary care physician. Because if they can't afford to see a primary care, they're going to wait until they can't avoid going to the emergency room. So what I see is that under the plan as written now, and even this plan doesn't have a mandatory coverage aspect.
No, Mr. Chair, you've been saying a lot of things. I was going to wait till you're done because you're saying a lot of inaccurate information. So I don't know if you read the bill, or if you read it, I don't know if you understood it, because a lot of things you're saying about employer mandate that is not here, it's here.
Okay, so you're saying this plan mandates...
It's about requiring that it addresses the amount of hours an employee makes that is eligible to be covered. A lot of things that you're saying, so I'm really asking politely if maybe you can read it and I can sit down with you, make you understand it, because a lot of things you're saying...
I've been trying to sit down with you for a while,
Ken.
And we haven't been able to find the time. But my initial look at it, I didn't see anything. It just answers the question, is it mandatory coverage for all companies to join this?
Finish your testimony, do whatever, and then we'll move on, please. Okay, come on.
Okay, I'll go ahead and finish my testimony here, because obviously, according to the author of the bill, I have dramatically misunderstood the tenets of the program. And maybe now their office will find time to sit down and set me straight on these bills. So I'll go ahead and go with Mr. Taggarty's testimony. Chairman, thank you for soliciting the viewpoint of the public regarding Bill 132-34. Since this bill was introduced in June, I was offended by the branding of the proposal with your own political campaign slogan. It appears to be an unethical attempt to extend your political campaign into publicly funded program materials. I urge your colleagues to remove this and all other references from the blatant electioneering from public policy drafts during the legislative session. Following the 1980s repeal of the Certificate of Need health industry investment restrictions, massive inflation and health care costs shifted health care as a factor in family and corporate budgets and the national economy. The medical professional, pharmaceutical, and medical equipment lobbies prevented the national adoption of universal coverage patterned after the successful Hawaii and Massachusetts state plans. The federal government then lagged Medicare and Medicaid reimbursements to slow price increases per procedure and formulary item. Key features of the Affordable Care Act were compromised at the beginning, causing its eventual failure. During this entire time, the National Public Health Service and federally funded health programs continued to provide basic care for Americans unable to afford market offerings. Proven federal and state health care delivery systems have been in place for decades, but our leaders lack the political will to adapt them to our needs. We understand that Guam opted not to expand Medicaid with Obamacare funds, especially since Guam has to cover 50% of the billings with its own revenues. But that begs the question, why do Guam leaders now propose to fully fund private insurance, administrative overhead, and corporate profits instead of direct medical cost of care? The direct cost of administering health care by Department of Public Health and Social Services, not GMH, is lower than through private insurers. Is the subject bill really the best proposal you can think of? I question whether this bill would expand coverage at all. It appears that employers will be able to shift the current sub-living wage employees to the 65% government subsidized program. Also, what company needs a special provision like Section 11 for off-island workers? Would that be United, Black, or DZSP? Each of which have low-paid employees contracted on but working outside of Guam. Paratodu looks like a federally funded welfare program for local companies. Please clarify these apparent corporate gifts. I favor the expansion of health care for those without and cost control. I also understand that investment in medical education, equipment, and places of professional practice must generate profit to be sustainable. Government of Guam and federal employees and corporate managers enjoy the best coverage. We see medical missions by local professionals and companies deliver care to neglected, remote, or impacted communities at no cost. Can your committee put all working models together for end-to-end to locally construct a continuum of care without placing health insurance companies, administrators, and shareholders first in line to be paid? Thank you for considering my perspectives on this very important proposal. Sincerely, Darrell A. Borja Taggarty.
Thank you, Mr. Zernin.
Pardon me?
No, Mr. Zernin, did you wish to testify on this bill? Yes. Please, slide the microphone closer to yourself.
Paul Zerzan. I'm opposed to this bill because I think it is not sustainable. Okay? I've lived in different countries that have universal health coverage, or whatever you want to call it, and the fact is, everywhere on earth, medical cares cost a lot of money. People get sick, they die, it's expensive. Nobody can afford it. We are trying to address a problem that has no solution, and no country on this planet has solved it, but they claim they do. So I've been in Taiwan and Hong Kong and other countries that have universal coverage. And as a working resident there, I'm covered by it. So I go to the hospital, and it's a lot quicker. I get quicker service, and I pay less money out of my wallet than I do in Guam. Okay? So it sounds like it's a really good deal. But the way they pay for it, they have no more, money doesn't grow on trees. We don't have unlimited money. In Guam, medical care seems unaffordable, but family housing is affordable. I can afford to have a family in Guam. Okay? Now, your thinking is 20th century thinking. In the 20th century, the biggest concern was overpopulation in undeveloped countries. And I don't think you are aware of how serious the problem of the 21st century is. The problem of the 21st century is depopulation in developed countries. Every industrialized country in the world except America has universal health coverage. And every industrialized country in the world except America is undergoing depopulation. They are not having enough children. And one reason is they cannot afford family housing. The other reason is, why have children? The government will take care of you with free medical care. Okay? That's what they think. And if you don't have babies, you get more sleep and more money. Okay? This is extremely serious. Taiwan is planning to close down half their universities. Half their universities because they don't have the population. I worked overseas as a teacher teaching English, and it's harder and harder to find work because there are fewer and fewer children. Okay? Hong Kong Express postponed its flights from Nagoya to Guam because of the North Korean crisis. Delta canceled their flights. Not because of the North Korean crisis, it's because Japan is a dying country. It's old people. When these old people die, there will be no more Japan. Sweden, Germany, Portugal, the UK, Canada are not having sustainable demographics. They're going the way of the Etruscans and the Spartans and the Assyrians, and you're not aware of this, but I live in these countries. I travel there. I see what's happening, and government cannot provide sustainable medical care. I wish it could, but it cannot. The way they pay for it is they don't have a future. When you don't have children, you've got a lot of money, and you can spend the accumulated capital of generations because there is no future. And that's why you go to France or Germany or Sweden or Denmark and you see this high quality of life because they are spending basically what we have in Fort Knox. There is no future there. Now, if you want to help the people of Guam, we don't commit national suicide with socialist programs. Socialism is sweet poison. Capitalism is a very bitter medicine, but it works. So you grow the economy on Guam. You reduce taxes. You provide jobs for businesses so people have employment. And then we can afford insurance. We can afford charity. Charity is a far more efficient means of delivering social services than is government. If I work for a charity and I think you're a deadbeat, I'm a volunteer. I'm not going to mess with you. Or if I work for a charity and I suffer from compassion exhaustion, there are too many sick people, I quit and I let another volunteer take place. But when government provides it, I'm a bureaucrat that only cares about my pension. And I don't provide services of quality. I don't care if you're cheating. And I'm not going to make trouble. I got a job. You come in here and tell me some sob story, I've heard it a million times, I don't care. Private charity works better than government, okay? So the government of Guam simply cannot afford this. This is an illusion. Universal medical coverage is a scam that causes national suicide. Right now we have affordable housing. We don't have affordable medical care. I don't want to go for the illusion of affordable medical care if it's going to mean we don't have affordable housing. Okay, does everybody understand what I'm saying? Anybody have any questions? Okay, thank you.
Mr. Pinsky.
Thank you, Speaker and fellow senators, Senator Rodriguez. From Guam Regional Medical City, I'm Eric Plinsky, Director of Corporate Affairs. I'm here on behalf of our CEO, Margaret Bengzone, and Chief Operating Officer, Dr. Michael Cruz. Senator Rodriguez, we would like to compliment you on a creative, a comprehensive, and a complex couple of bills. This really, my comments here are really about both the 13234 and 13334, so I'll kind of combine it, but it's short. Because of its complexity and the fact that our in-house legal counsel is off island and our Director of Government Reimbursement is in couple of weeks minimum already of jury duty, we haven't been able to tackle all of it and give as comprehensive of a review and comment as we'd like to. But preliminarily, we had to look at how would the bills affect GRMC and our patients. So I'll share with you our thoughts. And Speaker, I think you probably won't see this as much of a surprise from prior public hearing. Thank you for the opportunity to provide testimony for Bill number 132-34 that would establish a Medicaid managed care pilot program known as the Healthcare Pada Todu Plan, and Bill number 133-34 that would transform the medically indigent program known as MIP into a managed care program known as the Island Community Health Plan. Did I mispronounce that? Gave it a good shot. Due to the short notice...
Eric, I was just telling him that's not my campaign slogan.
Oh, I didn't know anything about that.
Yeah, because the other testimony said it was my campaign slogan.
Okay. But I appreciate the input of these gentlemen. Very impressive. I like your idea. Due to the short notice of the testimony request, Guam Regional Medical City is unable to provide a thorough review and comment for these bills. However, our preliminary review found that both bills present the same concern that GRMC expressed earlier this year in testimony against Bill number 3-34, Exclusive Health Plan for Gov Guam Health Insurance. Since neither of these bills require a bidding health plan to include GRMC and their respective provider network, as a result, any health plan selected by Gov Guam to participate in either of these managed care programs without GRMC and network would expose Medicaid and MIP beneficiaries to 1, extreme financial risk, 2, lack of equal hospital access, and 3, a restriction on the right to choose any local hospital. First, the financial risk component. Most patients access GRMC through the emergency room, and many are admitted due to the severity of their condition. When a health plan does not place GRMC in its provider network, the hospital bill is sent directly to the patient, and it becomes the patient's sole responsibility. For services at out-of-network providers, health plans generally require their members to pay the provider and then seek reimbursement from the health plan. The first primary challenge is that most patients do not have the money to pay for their hospital bills with no health plan negotiated rates. The second primary challenge that Guam-based health plans only give their members 90 days from the date of discharge from the hospital to prove that they paid their bill at the out-of-network provider by turning in their receipts and a copy of their medical records to the health plan. If the patient does not accomplish this within 90 days from the date of discharge, they are usually not eligible for any reimbursement from their health plan. You can imagine a hospital bill in 90 days or less to come up with the money to pay that on your own. The likelihood of that is slim to none. Okay. However, if the patient does manage to come up with the finances to pay the entire hospital bill within 90 days, they may then be eligible to seek reimbursement from their health plan at 70% of the eligible charges. However, this presents the third primary challenge, since eligible charges are determined by the health plan and rarely have anything to do with the actual billed charges. Eligible charges are commonly defined by the health plan as the lowest in-network negotiated rate, so 70% of that rate will only be a small fraction of the actual billed charges at an out-of-network provider. As a result, any reimbursement the patient would receive from their health plan would likely be a small percentage of the actual billed charges they would have already paid to the out-of-network provider. The second category, equal access provision. The Guam Medicaid state plan complies with the federal equal access provision in 42 CFR section 1396A30A so that care and services for Medicaid and MIP beneficiaries will be available at least to the extent that such care and services are available to the general population in the geographic region. If bill numbers 132-34 and 133-34 are passed into law, Medicaid and MIP beneficiaries may be exposed to lack of equal hospital access if any health plan is selected that does not have GRMC in its network. Finally, right to choose provision. The Guam Medicaid state plan also has a provision for the right to choose a provider, and a passage of either of these bills will restrict the right to choose GRMC if any health plan is allowed to participate that does not have GRMC in its provider network. It is important to realize that patients are generally taken to the closest hospital for emergencies due to the risk of death or serious bodily impairment, especially when they are transported in an ambulance. In addition, the majority of hospital admissions result from the emergency room visits. Therefore, GRMC feels that it is both unreasonable and unethical for a health plan to limit or restrict coverage at one of only 2 civilian hospitals on Guam, especially when GRMC is the only one that provides advanced specialty care. For these reasons, GRMC cannot support bills number 132-34 and 133-34 as currently written. Thank you for your time.
Thank you very much, Mr. Pinsky. Mr. Carlos?
Thank you, Mr. Speaker, Mr. Chairman Rodriguez, Senators. Allow me to read my written testimony. I'm in support of Bill number 132-34. This bill provides a framework for Guam to start the process of Medicaid expansion under Section 1115 of the Social Security Act. If approved by the Guam Legislature, the Guam Department of Public Health and Social Services can use this approved bill as a template to apply with Centers for Medicare and Medicaid Services to expand Medicaid in Guam. As of September 2017, 31 of the 50 states have applied for, given approval by CMS, and have implemented Medicaid expansion in their respective states. There is a map within this written testimony. It will show that there are 13 states which are Democratic states and 17 states which are Republican states. And this map was taken from the KaiserFamilyFoundation.org. The link is indicated in this written testimony. The former governor of Indiana, now Vice President Pence, applied for Medicaid expansion using a plan designed by a healthcare consultant and currently the administrator for CMS, Sima Birma. The Healthy Indiana Medicaid Expansion Program is funded by federal Medicaid funds, a 2% contribution from applicants with household income from 130% to 200% of federal poverty level, and the state of Indiana. The Healthy Indiana program includes a Power Health Savings Account for its Medicaid recipient. This program enabled Indiana to provide a significant revenue to the clinics and hospitals in Indiana. The proposed funding for the Guam Medicaid expansion is as follows. Number one, qualified applicants with household income from 108% to 200% of the Guam adjusted federal poverty level shall be required to contribute 2% of their income to a health insurance fund, as well as to contribute at least $500 to a health savings account. Number two, the Medicaid cost sharing is 45% Guam funds and 55% Medicaid funds. In other words, for every dollar spent, Medicaid pays 55 cents and government of Guam pays 45 cents. Its employer is mandated to contribute 65% of the 45% of the Guam share of the premium for its individual employee. Number three, there is approximately $168 million balance of the Affordable Care Act allocated Medicaid funding for Guam. Medicaid shall fund the 55% for its individual premium cost. This funding is good until 2019 and it's already incorporated in the Affordable Care Act. A 4% health insurance tax on health insurance premium for health insurance companies doing business in Guam. It is my understanding that insurers selling health insurance have been exempted from paying the 4% gross receipts tax through the GIDA qualifying certificate program. I think these health insurance companies are in good financial condition now and can give back some benefits to Guam. On May 1st, 2017, the Office of the Public Accountability issued a report of the 2016 audit of the Guam Memorial Hospital Authority. Some highlights of the report particularly on self-paying patients are, for the past 5 years, self-paying patients receive an average of 27 million medical care per year. The provision for bad debts averages 16 million or 59% of the billings. For 2016, the billings for self-care patients were 34 million. Collection were 43%. And then it says that GMHA continues to provide 32% provision for bad debts. GMHA has raised hospital fees by 5% effective April 1st, 2017, and another 5% every subsequent fiscal year. I submit that the above information from the audit of GMHA suggests that the government of Guam and the patients with insurance coverage are paying and in effect giving indirect subsidy to some of the self-paying patients who have no insurance coverage. It has been demonstrated that the Medicaid expansion provides a net financial benefit to the Medicaid expansion states. Also, the increase in the cost of insurance in the Medicaid expansion states and the individual, the small and large health insurance market is more moderate. The proposed U.S. Senate Better Reconciliation Act of 2017 converts federal Medicaid funding to a per capita allotment and limit the growth in federal Medicaid spending beginning in 2020. Similarly, the proposed H.R. 1628, American Health Care Act of 2017, also converts federal Medicaid funding to a per capita allotment and limit growth in federal Medicaid spending beginning in 2020, using 2016 as a base year, as well as provide state option to receive a block grant for non-expansion adults and children or only non-expansion adults. Although it is not certain if either the House or the Senate bill for health care will pass, there is a common feature in both proposals by the U.S. Congress, in that federal Medicaid funding could remain in reduced amount, in allocated amounts, but be converted into either a per capita allotment or a block grant beginning 2020. Lastly, may I point out that the reimbursement under Medicaid funding for the other states is very high compared to Guam. In some states, they get 80% funding from Medicaid. The lowest, I think, is maybe around 70. In contrast, Guam only gets 55 cents to $1. For all the foregoing reasons, I believe Guam should at least try to provide a mechanism in order to submit something to the CMS that we're trying to make use of the funds that were allocated to us. And secondly, the mechanism here wherein we require some form of contribution from the qualified recipients is similar to that which was approved for Indiana. We should take that into consideration. If we don't do nothing, there's nothing to be lost. But if we get approval for some reason from CMS, particularly in the person of Sima Birma, it will be a net gain not only for the inhabitants of Guam, but also for the medical providers as well as the hospitals, GMHA and GMRC. I'm in favor of this bill.
Thank you very much, Mr. Collis, for your very comprehensive testimony. Mr. Chairman?
Thank you very much, Mr. Chairman, and thank you to all of you for your testimony. We look forward to being able to explain this further to the community and also for to my colleagues. But just to give, just as my closing here for this bill, and to try to explain it in simple terms, what this is that there's a big population of our people who are the working individuals who don't have health insurance. These are people that work in companies, the companies do not provide them health insurance. And so what this does is that 108 to 200% population, we estimate to be about 16,000 individuals that would be affected by this. we would now help them pay for a employer-sponsored health insurance premium. So we have over 170 million that's still in the account in the bank that the federal government provided Guam from the Affordable Care Act. And so from that, that's where we are anticipating to use the 55% that the federal government is providing. So let's say a premium of $4,000 now will be split 55-45. The 55, I think that's about $2,200. That $2,200 will come from that federal money, the 170 million that we still have. The 45% now would come from the government of Guam. And the formula is that there's three sources of that. One would be the employer, because the bill has an employer mandate. The employer must pay 65% of the remaining $1,800. And so the second source of funding that 45% would be the employee. The employee now would have to pay no more than 2% of their annual income. And if you do an individual who makes minimum wage, a full-time employee, that comes out to be about $365 a year that they would be obligated to pay. However, if they take advantage of the incentives that this bill requires, that the insurance that they purchase have incentives such as what we have in the government of Guam. If you go to the gym or wellness center 10 times a month for a quarter, you get a certain amount, up to $400 a year that you're able to receive as an incentive. For this, we say you must have that program. The money you receive does not go to you for you to go spend and buy cigarettes and go, spend a night out of town. It's your money, but it must be put into a health savings account. So that health savings account grows, stays with you, and you can use it now when you have to go to the hospital or when you go to the clinic for your copay or if you need to pay for your medicine. That's what your health savings account will be used for. The final source of payment on the remaining would be from the government of Guam. And that's where it's not existing government resources that we're going to use. The proposal is to assess the 4% on the $250+ million a year industry, which is the insurance industry, is to assess that 4%. And from that, about $12 million a year that we anticipate will be used to fund the government share of that $1,800 that we're required to pay for. And so by doing that, more people will be covered. The whole idea is that they don't go to the hospital. The whole idea is they go to the primary care clinic, that they get primary care and prevention services. But if they do end up in the hospital, we want to make sure that they have coverage and they're able to pay for that. So that's really at least a short period of time that I have here to be able to explain in simple terms. But we'll, as we've talked to GRMC, we're going around the community and explain this plan. And so we'll do that as much as we could before we ask the chairman to place it on session agenda. So thank you very much, Mr. Chair.
Vice Speaker, yes. Do you have any questions?
Only wanted this sponsor. Could you just tell us which part in here talks about that 4%? Sorry. On the bill? Yeah. Is it in?
Yeah.
Sure. Okay. Yeah.
Questions of the panel, please. If you have none, thank you. Senator Lee, do you have any questions? Senator Nelson, any questions? Senator Escobar. Thank you. Thank you very much. Yes, there is no, go ahead.
Okay. Now, it sounds to me like there'd be quite a bit of administrative costs in this complex program.
Okay, you can take that up with him later. We're going to move on, okay? Thank you. Bill 133. Mr. Leon Guerrero, Mr. Zerzan, Mr. Darrell Taggarty, Mr. Carlos, and Mr. Ilagan. I guess you're the only one staying.
If I can just read into the record, Mr. Chair. Mr. Chair, Bill 133 seeks to reform the medically indigent program. This program, it breaks up the existing MIP program into 3 separate programs. And the first program would be the Manelu Care Program. We anticipate this target group will remain the same as those that fall within the 0 to 100% of the federal poverty level. That means everyone now that is covered by MIP will still be covered. This program would mirror the existing MIP but be converted into managed care methodology. During the transition, specific benefits will be reviewed and adjusted to meet the current needs of this population. The second component of the reform MIP that we are proposing is Manelu Plus. Working with representatives of the FAS and COFA neighbors, we plan on providing Manelu Plus. Manelu Plus would expand the eligibility criteria to FAS and COFA citizens from the current maximum of 100% of the federal poverty level based on a contribution from various FAS governments to the program up to 200% of the federal poverty level. Benefits would remain the same as proffered in the Manelu Care Plan, except more FAS and COFA citizens would be eligible. The final component is the Manaina Care. Many of our Manamku are not eligible for Medicare or have needs that are not covered by Medicare. A core principle in our culture is respect for our elders. Manaina Care would provide coverage to our local U.S. citizens over the age of 65. Specifically, coverage would be provided for skilled nursing care to take care of the special needs of the elderly. Additional coverage benefits will also be reviewed to focus on the specific needs of the over 65-year-old population. Mr. Chair, just to explain a little bit about the Manelu Plus, the second component of this MIP reform. What this does, Mr. Chair, is work with the governments of the COFA and FSM to be able to have them contribute funds, because we know they receive compact money. We receive compact impact money. These islands receive compact money. But our understanding is that a lot of times on a yearly basis, funds are not expended. And so we're given an opportunity for them to be able to help their citizens that come to Guam by us allowing a program that would pay, but their contributions would pay for those COFA citizens who are here but are not eligible for Medicaid because they're not U.S. citizens or they're not green card holders, or they don't qualify for MIP. Example of this is an individual who works at a supermarket, a COFA resident who's on Guam that works in a supermarket, makes over the 100% of the federal poverty level, which is more than, he makes, even if he makes minimum wage, he doesn't qualify for MIP. And if his employer does not provide health insurance for him, then he really has no coverage because he can't go to Medicaid because he's not eligible because of his status, his citizenship. And so what this does now is afford them the ability to have access to health insurance coverage, but also having their governments provide the subsidies that's needed. And I understand this is beyond our control. It requires us to work with these governments, but it sets up a template and a framework for us to be able to have these discussions. During the course of 2 years, we've met with the Chuk governor and his administration, and they seem very interested and willing, and are willing partners to be able to join us in this type of initiative. So we're hoping that we can move this forward, Mr. Chair. Thank you.
Thank you. Did you have testimony?
Good afternoon again, Mr. Speaker, Mr. Chairman Rodriguez, Senators. I don't have a written testimony. I will submit a written testimony. However, I'm in favor of Bill number 133-34 insofar as the concept of delivery of health care. The current practice is that the Department of Public Health and Social Services processes the health care provider fees on the basis of provider billings. So if I am a medical provider and if I want to charge and generate more medical fees, I would, in effect, start seeing this MIP recipient to come to my clinic as often as I could and bill as I would upon the medical procedures that I have provided. There is no management of patient and doctor relationship, and there is no control. It has been submitted that in many of the 50 states, healthcare delivery is better done by the private sector in the form of managed care. And secondly, the data generated by the private sector, because they are considered third parties, is more reliable than the data submitted by any government of Guam agency. If we will allow the transition to a managed care being done by the private sector, assuming by health insurance companies or some other form of accountable care organization, then the function of the Department of Public Health and Social Services in the delivery of Medicaid indigent patients will be that of a manager, an overseer, or auditor. They won't be processing the bills. The bills will be processed by the project sector. And so, what Department of Public Health expertise will be to see to it that the billings are appropriate and correct. At this point in time, I am not entirely convinced because of the lot of work they're doing just in the processing of these bills, that they have the time to scrutinize and to audit the bills being submitted by the private medical providers. On that concept of transition to the managed care, I'm in favor of this bill.
Thank you very much. Does anybody have a question?
Actually, just a question for clarification from the sponsor of the bill. Might be an oversimplification, but I guess for the record and for the public at large, what we're looking at with 132-34 is basically gap insurance, and we hope that it'll be funded by the government of the COFA migrants. Is that correct?
Senator, on Bill 133.
I'm sorry, 133. My apologies.
Yeah, that's one of the components of the revised. Yes.
Okay. Thank you, and thank you for providing testimony.
Okay. Thank you very much. Anybody else have any questions, Mr. Carlos? Thank you. The committee will continue to accept written testimony on all three bills and the bill this morning for the next 10 days. Please provide written testimony. See Office of Speaker Benjamin B.J.F. Cruz, Guam Congress Building, 163 Santa Papa, Hagåtña 96910. You may also send it via email to senator@senatorBJCruz.com. On that note, we will adjourn the hearing.